Hospital Lingo, understanding medical slang. Hey everyone, welcome back to our series on slang and colloquialisms. Today, we're diving deep into a unique setting, the hospital. Just like any other industry, healthcare professionals have their own set of slang and colloquialisms that they use in hospital and clinical settings. If you've ever been curious about what your doctor or nurse might be saying behind the scenes, stick around. Let's decode some hospital jargon together. First, let's tackle some of the most commonly used slang in hospitals. 1. Frequent flyer. A patient who frequently visits the hospital or emergency room. 2. Code brown. A rather humorous way to refer to a patient having a bowel movement or accident. 3. Vampire. Phlebotomist or any medical professional known for drawing blood. 4. Baby catcher. An endearing term for an obstetrician or a midwife. 5. GOMER. An acronym that stands for Get Out of My Emergency Room. It is sometimes used, albeit a bit rudely, to describe a patient who frequently visits the ER without a clear medical need. Hospitals are bustling places, and to save time, medical professionals often use abbreviations. Here are some you might come across. 1. SOB. Shortness of breath. Don't get this confused with the common insult. In a medical setting, it's purely clinical. 2. DNR. Do not resuscitate. This refers to a patient's wish not to undergo CPR or advanced cardiac life support if their heart stops or they stop breathing. 3. AMA. Against medical advice. When a patient chooses to leave the hospital before their doctor feels they should. 4. NPO. Nothing by mouth. If you hear this, it means the patient shouldn't eat or drink anything, usually in preparation for a procedure. Even in serious settings, healthcare professionals use some light-hearted slang to break the tension. 1. Tombstone trolley. A bit of a dark humor term for a gurney or stretcher, especially if it's meant for a deceased patient. 2. Bounce back. A patient who was discharged but returns to the hospital shortly after for another issue. 3. Organ recital. When a patient lists all of their medical issues, often in great detail. There you have it, a peek into the unique language used in hospitals and clinics. As with all professions, slang and colloquialisms provide a sense of camaraderie among professionals and sometimes even lighten a heavy atmosphere. Remember, the intention behind most of these terms is not to be offensive but to communicate efficiently. We hope you found this video insightful, and we'll see you in the next one. Stay curious and keep learning.